For those of you who are here, it looks like there's about 5 of you here. Can somebody give me a thumbs up if they can hear me? Okay, so we've got a couple thumbs up. Looks like at least a couple of you can hear me okay. Just want to make sure everything is working okay. Trying to avoid some of the snafus that we had 2 weeks ago with our presentation. All right, guys, well, according to my watch, it is 7:30, so we are going to get started. It looks like there's about 5 or 6 of you in the room with me watching the presentation right now, so I hope others will join. Hope everybody's hearing me okay. If there's any issues with the video or audio, somebody, if you could please let me know, I'd appreciate it. But we're going to go get ahead and get started. So the format of this live event will be just like the format of the last live event. No pictures yet. Okay. You should have a title slide up on your screen called Senior Pet Care. The corgis are watching. Okay, very good. All right, well, we're going to go ahead and get started here. So the format of tonight's talk will be very similar to the format of the talk 2 weeks ago. For those of you who may have been there, I want to go through the slides, and at the end, we will have a question and answer session. The one thing that rule that I will set and that I will ask is that the questions that you ask me be about the material in the presentation. I cannot answer questions about your pets that are not related to the topic that we're discussing tonight, because that's not fair to the other folks who are here to hear this topic. So we will limit questions to the topic at hand. So our topic for tonight is senior pet care, and this is something that is near and dear to all of us who have aging pets. For those of us who hate watching our pets grow older, and for those of us who, all of us who dread end-of-life decisions. And so the goal is to give you some information on things you can do at home to improve quality of life, diseases that we commonly see in older pets. And trust me, folks, this is not intended to be a comprehensive presentation. I can't possibly sit here and go through in an hour all of the diseases of older pets. There's just not enough time. So I'm going to go through the things that I see most commonly, with a briefer mention of things that I see less commonly. And then obviously we'll have a question and answer session at the end. And I hope you guys are willing and able to participate in that. So I'm going to be honest with you guys. I finished putting this presentation together this afternoon. At least one person in this room will attest to that fact, that I was working on it when they walked in. And my second slide has a spelling error, so I apologize for that. Senior pet care. It'll take a few seconds for that slide to come up. I apologize. So yes, that's supposed to be senior pet care. So I'm sorry about that. So this will be a head to tail review, and we're going to discuss special concerns based on body system, things to watch for at home, ways to improve comfort, and ways to manage senior diseases, and obviously is to help you make end of life decisions for your pets, and what that may look like, what that may feel like, and some things you can do to sort of ease that transition. Not that it will ever be easy, but things that you can do that may help make that easier for you. So people often ask me, well, how old is my pet in human years? Is it 7 years for every human year, or how does that work? And the answer to that question is that it's not that easy. So what you're going to see before you here is an age chart based on the age of the pet and the weight category of the pet. We all know that small breed dogs tend to live longer than large breed dogs, and so they age at a different rate. And dogs and cats age differently as well. So these aging charts were largely the work of Dr. Fred Metzger out of State College, Pennsylvania. He came up with these aging charts, and I think they're pretty accurate and pretty useful, and they answer the question for a lot of my clients about how old is my pet. So if you're looking at the dog chart on the left, what you're going to see is if you have a 9-year-old dog on the left there in orange, and that dog weighs between 1 and 20 pounds, that 9-year-old dog is about equivalent to a 52-year-old person. If you have a 9-year-old dog that is greater than 90 pounds, that animal is more equivalent to a 71-year-old person. And so these charts are a much more accurate way, at least in my mind, of telling people how old their pet is in human years, quote unquote. And as you can see, cats tend to live a pretty long life. I had a cat that lived to 19. That's the oldest cat that I've had, but I've seen cats here in the practice over 20 years old. So they can live for a very long time. So you can actually, if you go on the Pet Health Network, you can find these charts. You can actually just Google pet age chart, Fred Metzger, and these will come up. Google has everything. So if you're looking for a copy of these, you can certainly find these online, and they should be readily available for you. So now what we're going to do is we're going to talk about, we're just going to kind of work from head to toe and talk about different body systems and the different concerns that we have for senior pets. So we're going to sort of go jokingly from ears to rears, or actually from nose to tail, but and if there's anything I leave out or anything that you have questions about, certainly at the end, catch up with me on that. So first of all, senior pets, especially as they get much older, their sense of smell can decline. And when a pet can't smell, they're not as likely to eat. And so if a pet seems to be turning their nose up at food, it may not be anything more than they just can't smell it, or it doesn't smell as appealing as it once did when they were younger. And so some things that you can do are to warm up the food. Cold food, especially canned food out of the refrigerator, is not very appealing to a lot of animals. So if you warm it up, that will often help. And then two, if you buy food that really makes your stomach churn, it's more likely that they will eat that because they can smell it better. So Hi, Lisa. Hey, Cindy. All right. So yeah, getting extra smelly food will often help with that problem. So just be aware of the fact that sense of smell may not be the same. Visual problems, older pets may not see as well. May be affected by cataracts. Certainly, we see cataracts. Cataracts are most commonly seen as a sequela of diabetes, but there are certain breeds that develop cataracts independent of diabetes. And so cataracts can be a problem later in life. There can even be juvenile onset cataracts, but I'm talking about the aged pet. So cataracts can certainly be a problem. Glaucoma can be a problem in our aging patients. Certain breeds are predisposed to glaucoma. Beagles, Bassets tend to be high on that list. So that's something we need to be watching for. And then certainly changes in the retina, which is the part of the back of the eye that actually causes vision. Those are things that you need to watch for. Things that may cause retinal changes are elevated blood pressure. There could be bleeding in the back of the eye that's causing the retina to detach. Hey, Carol. So there could be retinal changes that are causing sight issues, and so we need to address those underlying issues as well. There's surgery for cataracts. Certainly, there's medications to control blood pressure if that's part of the issue. Glaucoma can often be controlled with medications and managed. And the big thing with vision loss in older pets is often those dogs will do very, very well, even if they're blind, as long as you don't change anything in your home. They will find their way around and adapt very, very well. As soon as you move the furniture around, that may change. They may start walking into things. So if you have a blind pet, it's important to keep everything the same. And just be careful of stairways and things like that where they may fall, and be more cognizant of the fact that they can't see. Moving right along, oral disease. So we touched last time in preventative care about dental disease and prevention of dental disease, but certainly as pets age, just like in people, oral problems become more of an issue. And so we have to be aware of those things. And poor dental health may lead to decreased eating. And then two, we have to realize that prolonged poor dental health has been associated with bacteria being released into the blood and having negative effects on the heart, liver, and kidney. So this isn't just a mouth issue. This is a whole body health issue, and it's something that should be addressed. And two, remember what we said 2 weeks ago, if you were there, that the mouth is not just for eating in pets. The mouth is also their hands. It's a thing that they use to carry things around. So that animal may not want to play ball or frisbee or do the other activities because their mouth hurts too much. So be aware of that. And sometimes when you're trying to address dental care on older patients, that's probably not the right time to say, okay, now I'm going to start brushing my dog or cat's teeth. I could tell you that if they're not used to having that done, and especially if they have pre-existing dental disease and their mouth is not comfortable, if you try to do that, that may not go well for you or for them. So be careful about that. Certainly, you want to address the underlying dental disease and then discuss with us what you can do at home to slow the progression of that disease. So, hey, Ken, how you doing? Becky, how are you? Thank you for joining us. Dental care is important. And just like in people, it's a combination of professional cleaning and home care. And often I hear about people that are doing dental cleanings without anesthesia. They're seen at pet expos and things like that. Again, I know of no pet, dog or cat, that is going to allow you to clean up under the gum line where periodontal disease occurs while they are awake. How many of you enjoy getting your teeth cleaned at the dentist? How many of you actually enjoy doing that? Well, if you can imagine, your pet is probably not going to enjoy that very much either, and that's why they have to have general anesthesia. So some things to consider there. Oral health is important in our senior pets. So we've covered vision, we've covered sense of smell, we've covered oral health, and so now hearing. Let's consider hearing. Hearing may be diminished with age, and it's often just a normal aging process that has caused the hearing loss. Some dogs, if they have pre-existing ear infections throughout their life, will be more predisposed to hearing loss, but certainly it can happen without the presence of infection, just as a part of the normal aging change. And you just need to be aware of that, because if your pet is not obeying or responding, that can potentially be a problem or a safety issue. If your dog's out in the yard and goes running after something, you need to be cautious of the fact that, and be aware of the fact that your dog can't hear you. And the pet may startle easily. Hey, Kim. Pet may startle easily, and if you have a sleeping dog and you have kids or grandkids that come in the home, and they go over and touch the cat or dog who can't hear well and can't hear them coming, they may get scared, and a scared animal will respond the way a scared animal knows how to respond. And that may be scratching, biting, running away. But you need to be aware, if you have an animal that can't hear well, if they startle when they wake, or if you're trying to wake them and they startle, you may need to stomp on the floor or do something a little more remotely from the animal to arouse them, so that you're not taking a chance of getting hurt in the process of trying to wake them up or get them to move, or whatever the case may be. So special considerations if there are hearing issues with your older pets. So now we've covered vision, smell, oral health, hearing. So we're just going to keep moving sort of down the animal. Heart and lungs. We're going to cover heart and lungs. Certain breeds are predisposed to heart disease, and this is most commonly caused by age-related change to the mitral valve, which is one of the hey Sharon, one of the valves within the heart. So you've got the pulmonary valve, the mitral valve, the tricuspid valve, and the aortic valve, 4 different valves in the heart. The mitral valve is the one that is most commonly affected. So we all know that the heart is a muscle. It acts as a pump, and it's essentially forcing blood to flow through the body, and it's only meant to flow in one direction. So oxygenated blood goes out to the body where it's needed. It eventually returns back to the other side of the heart to then be pumped to the lungs, where it gets oxygen, then back to the heart again, and then back out to the body. So it's essentially a loop. It's going through a loop, and that loop should only be in one direction. The valves live between the chambers of the heart, and they keep blood from flowing backward. What can happen with age is the mitral valve, or any of the valves for that matter, but most commonly the mitral valve, will become thickened, and then that valve won't seal well anymore. And so then blood is allowed to flow in the wrong direction. And it's sort of like putting your finger over the end of the hose. Because it's partially closing, the blood squirts through there pretty quickly in the wrong direction. And that's what can cause an abnormal sound. When I actually put my stethoscope to the chest, I can actually hear that in what we call a heart murmur. And we grade those murmurs on a scale of 1 to 6, 1 being the softest, 6 being the loudest. So varying degrees of heart murmur can occur. That blood flowing backward causes too much pressure in the upper chambers of the heart, and eventually we get heart failure. So the atrium, which is the top layer of the heart, starts to enlarge. So if you think of a balloon, adding pressure and adding pressure and adding pressure, it gets bigger and bigger and bigger. Eventually we get congestive heart failure, and fluid will accumulate in the lungs, which means that the animal can't breathe very well. So there are medications we can use to manage this disease. This is not a disease that we can cure. And then 2, the important thing is that we can't assume every murmur that we hear is a mitral valve murmur and is treated the same way. And so this is where it's very, very beneficial to get a cardiologist involved, where they can take a tool called an ultrasound and do an echocardiogram and actually look at the heart to find out where the murmur is coming from, and then address it appropriately. So characterizing the heart disease is important because that will lead treatment decisions. And then treatment involves chronic medications, and where chronic medications are involved, and we also need to monitor very closely. We need to monitor kidney function and various other things that those heart medications can affect. And so what you're seeing, or should be seeing on the screen now on the upper right-hand side, is an ultrasound of the heart. And then on the lower right is an x-ray of the heart. So that heart on the lower right is enlarged, and it is actually pushing. You can see that black stripe coming. It's kind of a horizontal black stripe there. That's the airway coming down into the chest, and the heart is actually pushing up on that. And you can see that an x-ray shows you the outside of the organ, or the silhouette of the organ, but an ultrasound shows you the inside of that organ and what the structure internally is doing. And so there are two tools to tell you different but useful and both beneficial information. So yes, we can show there's heart enlargement with an x-ray, but we can't actually tell what's going on internally with the heart without an echocardiogram or ultrasound of the heart. That's how that works. Primary lung disease is not as common as primary heart disease in older patients, but we can see things like COPD, things like that. We can sometimes see asthma in cats, although that tends to be, we catch that usually pretty early. We don't necessarily consider that a geriatric disease. So heart disease is much more common. Even in cats, cats can get hypertrophic cardiomyopathy, which is a thickening of the heart muscle, which means it doesn't work as well. So again, that's something that needs to be diagnosed via ultrasound. So cardiac disease, we covered that. So things that you could be watching for at home that may suggest cardiac disease: coughing, exercise intolerance, elevated respiratory rate. If you have a coughing dog or cat, and cats tend to not cough as often related to heart disease, but one thing you can do at home is count the respiratory rate at rest. So the animal has to be at rest. This isn't after you just went for a walk outside. This is the animal is laying at your feet. You're watching TV. The animal's almost basically asleep. And you watch the chest rise and fall. That's 1 breath. Rise and fall, that's 2 breaths. Rise and fall, that's 3 breaths, etc. You count that for 15 seconds, and then you multiply by 4, which will give you a respirations per minute. And our goal is below 32 breaths per minute. And if your pet is coughing and having exercise intolerance and is consistently above 32 breaths per minute at rest, that would be a reason to give us a call. So I hope I didn't confuse anybody or make that terribly unclear, but those are things you could be watching for: coughing, exercise intolerance, increased respiratory rate, increased respiratory effort. These are all signs of heart problems. All right, moving right along. So we've covered basically everything from the head through the chest at this point, and now we're moving into the abdominal cavity with our diseases. Everybody still with me at this point? Can I get a heck yeah or a hallelujah or something to let me know that people are still listening? That'd be great. So we're moving right along here. Kidney disease. Kidney disease, we see this fairly often in both cats and dogs, especially in cats. I got a thumbs up. Thank you. Thank you. At least I know you're still listening. Cool. So decreased kidney function is called renal insufficiency, and it's difficult to detect early on. We don't have a lot of really good tools to detect kidney function. Traditional kidney values on our blood work do not go up until 60 to 70%, probably more like 7. I got an hallelujah, amen. All right. We're going to church here. All right. Traditional kidney values that on our blood work typically don't go up until 70% or more of kidney function is lost. And so that may seem alarming, but it really shouldn't be, because I want you to think about it this way. people can donate a kidney to somebody else, right? So there are people walking around that are perfectly healthy with 50% of their kidney function, right? So it shouldn't be surprising that it takes more than 50% loss to run us into trouble. It's more like 70 to 75% loss where we start to have issues. All right. There's a newer blood value that we run now called SDMA, which can detect kidney disease much earlier. And it's been a very useful tool in the early detection of the disease. And we include that on many of our blood panels. All right, Ken and Sharon are still here. Carol's here. We're all good. We're moving. We're chugging right along. So I got 6 faithful ones here. 7 faithful ones here. Good. Also of interesting notice, there's a recent study from IDEXX, who is one of our reference laboratories, that has shown that animals with a history of tick-borne disease like Lyme disease, Ehrlichia, Anaplasma, are much more likely to develop kidney disease down the road. So just another reason to be very careful about tick exposure and make sure that your pet is getting good tick prevention. So other things to consider there. So with kidney disease, the first thing we need to do is rule out any treatable causes. All right, and by treatable causes, I mean things like infection, things like blockage of the urinary tract somewhere, whether it's between the kidney and the bladder or from the bladder to externally. A blockage will cause kidney problems. All right, perhaps it's a tumor of the kidney, something like that. So we need to rule out those types of things, and then if those things have been ruled out and it's just kidney, some kind of kidney disease, we don't really know the underlying cause, then it's kind of supportive care. And by that, I mean fluids to help flush out the kidneys and flush out the toxins that the kidneys normally flush out, prescription diets to restrict protein and restrict phosphorus, perhaps phosphorus binders, because the kidneys are responsible for a number of things. They flush out toxins. They also help control calcium. They help control phosphorus. They help control our electrolytes, like potassium and sodium. And they help retain protein. So there's a lot of functions that the kidneys do. So we need to help the kidneys along. So fluids help flush out the toxins. Prescription diets reduce the amount of toxins made and to begin with. Phosphorus binders help get rid of phosphorus. And then we need to manage secondary issues. What do I mean by that? Well, cats and dogs rarely get high blood pressure like people do. People get primary high blood pressure, meaning it happens by itself. That's very rarely the case in cats and dogs. They're usually high blood pressure in a cat or dog patient is secondary to some other underlying problem. And kidney disease is a common one. So elevated blood pressure needs to be dealt with so that we don't cause further kidney damage, so that we don't cause retinal bleeding in the eyes, which can cause blindness and various other problems. So blood pressure needs to be corrected, and then we need to try to control protein loss through the kidneys, which can cause further kidney damage. So that can become a cyclic thing too. So there's a bunch of things we can try to treat and control. But as you can see, kidney disease is a management disease, not a disease that you cure unless there is a treatable cause that we can eliminate. So our next slide sums up pretty nicely, just what we talked about here. Take a few seconds for you guys to see it because there's always a lag. All right, so kidney disease is a management disease, again, unless it is due to something acute and treatable. It cannot be cured, and so it requires long-term management, repeating blood work to monitor things, and frequently checking in with us. Now, the University of Pennsylvania has a kidney transplant program. Very, 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 very expensive program. It is, you also, to my knowledge, and it's been a long time since I've looked into this, but to my knowledge, you also have to adopt the donor animal as well. And last I knew, this was just for cats. So I'm not sure if it's for dogs or not, but I do know they have kidney transplant available there. So it's out there and available. Disease is almost always progressive. And signs to watch for: increased drinking, increased urination that is often large volume. So you may start to see accidents in the house. And again, these tend to be large volume accidents. And that's important because we'll talk about that again later. Appetite may be decreased, and there could be some weight loss as well. So those are the big ones. The big ones that I have people bring dogs in for are increased drinking and urination because they don't like their dog urinating in the house. So that's the most common thing that I see the dog or the cat for. Owners of cats will come in and say the litter box is being flooded, and my cat is constantly at the water bowl or pestering me for water or wants me to turn on the water at the faucet all the time. So those are the most common signs that we see. I want you to remember the increased drinking and increased urination because we're going to revisit those signs a few more times before this presentation is over, because it is common to a number of other things that we're going to talk about that are seen in senior pets. So keeping within the abdomen for the moment, we're going to talk about another common thing that we see in our aging pets, and that is diabetes. So we may have diabetic people watching right now. We may have people with diabetic pets watching right now, or who have had diabetic pets in the past. So diabetes, just like in people, there's type 1 and type 2. In dogs, it's typically more of a type 1, meaning there's a true lack of insulin. Cats are typically more of a type 2, where there's either decreased production of insulin and or more likely insulin resistance. So they're a little bit different, but they're essentially both treated the same way. So that's not really super duper important. But what insulin does, it's produced by the pancreas, which is an organ that lives right next to the stomach and the intestinal tract in the abdomen. And it does a number of things, but one of the things that it does is produce insulin, which helps cells in the body use sugar or glucose as an energy source. If you lack insulin or are resistant to insulin, that means that your body can no longer use glucose as an energy source. And so instead of being used, it tends to accumulate in the blood. So it requires insulin to treat. Insulin is typically given by injection and is given every 12 hours. So the reason I stress that is that if you're going to treat insulin, it means wrapping your life around an every 12-hour schedule. So do you have other people that can help you out if you're not going to be home? Do you have other people that are comfortable giving injections? Are you comfortable giving injections? And I think you'd be surprised how comfortable you can get. We'll take the time to teach you how to do that if need be. So don't let that discourage you. It's more prevalent in animals that are overweight, so this is a good reason to manage weight early, as we discussed in our last lecture on preventative care, especially in cats. We see this a lot in obese cats, so you really need to be careful with weight management. So again, treating the disease involves giving insulin twice a day, and ideally blood sugar levels would also be checked at home. There's a number of different ways to do that on pets, either from the margin of the ear or a foot pad, or sometimes from the lip. You can get a little bit of blood and check it on a glucometer just like you would a person, and monitor that throughout the day or throughout the week. So the other ways, things that we can do to help treat diabetes are a low carbohydrate, high fiber, or high protein diet, which helps stabilize blood sugar, which is what I mean by that is If you eat a lot of carbohydrate, your blood sugar shoots up dramatically right after you eat that. That's the last thing we want in a diabetic patient. So fiber tends to slow that down dramatically, and protein tends to slow that down as well. So you remember when we talked about kidney disease, we talked about the fact that increased drinking and increased urination were signs of kidney disease. Well, guess what? Increased drinking and increased urination are signs of diabetes as well. So that's why I told you to remember that. So here we go again. We've got a pet that's at the water bowl more frequently. We've got a pet that's possibly urinating in the house or waking the owner up to go outside in the middle of the night where they never did that before. We've got a cat who is flooding the litter box and or going outside of the litter box. So these are the signs that I most commonly see pets for, and that's why they're coming in. And so people ask, why is my pet drinking more or urinating more? I say, well, it could be a kidney problem or it could be diabetes, and there's a few other things that it could be. So common signs to be watching for in your pets. Typically with diabetes, the appetite is normal to increase in the beginning, and there is weight loss. So they're eating well, but they're losing weight, and that's because they can't use glucose as an energy source anymore, and it's much harder for the body to convert other things to energy. So they're losing weight even though they're eating. If you leave it untreated, they go into diabetic ketoacidosis, which is a big fancy word for a very life-threatening metabolic issue, and those pets require hospitalization, intensive care, blood sugar management, electrolyte management. It is a scary thing, and they can die from it. So it is not something you just want to ignore. It's something that you want to treat and try to control. All right, so bear with me here. All right, is everybody good on diabetes? Again, if you have questions about any of these topics at the end, we will have a question and answer session. So write down your questions, remember what they are, whatever you need to do, and let me know what those are at the end, and we'll cover that. All right? So moving right along. So both cats can get renal disease, dogs can get renal disease, cats can get diabetes, dogs can get diabetes. The next one we're going to talk about is a feline disease. It's hyperthyroidism, so overactive thyroid. This is a feline disease. It is very rare in dogs. If it occurs in a dog, it is very, very bad, typically, because it is usually due to a malignant tumor of the thyroid called a thyroid adenocarcinoma, and those dogs do not do well. So if a dog is hyperthyroid, it's bad. All right. I once had a dog come in that I thought was hyperthyroid, and I thought I was going to diagnose thyroid adenocarcinoma, and then I found out that the owner was giving kelp as a supplement. Kelp is very, very high in iodine, and so essentially by over supplementing with kelp, the dog was becoming hyperthyroid. So be careful with supplements, folks. That's all I'm going to say. Is just because they're all natural doesn't necessarily mean they're safe. Just use caution, just a word of caution there, okay? So this is a feline disease, and the thyroid controls metabolism. So when your thyroid becomes overactive, your metabolism goes way, way up. Sometimes I wish I was at least just a little bit hyperthyroid. I could use that. So cats with hyperthyroidism have a tumor of the thyroid gland, but it's a benign tumor. The problem is that it doesn't follow the controls of the higher centers in the brain. It just keeps pumping out thyroid hormone to its heart's content. And the more thyroid hormone there is, the higher the metabolism is. So signs include increased appetite and weight loss, poor unkempt coat, vocalizing. These cats will often cry in the middle of the night. They'll just start crying for no apparent reason. We're not sure why they do that. People with hyperthyroidism tend to have hypertensive headaches. So we're wondering, some have speculated that maybe these cats are going through that, but they will just vocalize randomly. And guess what? Increased drinking and urination. I sound like a broken record, but you can see where this can be a diagnostic dilemma when somebody brings me a pet with these signs, okay? Often with this disease, though, it's the increased appetite and weight loss that brings the cat to me. The cat starts stealing food off the owner's plate. The cat is constantly screaming to be fed. It's driving the owner crazy. 3 a.m., it's screaming to be fed. Hungry, and yet it's losing weight. That's the most common thing that I see cats for with this problem. But again, all those signs are things to be watching for. Often on physical exam, there's an elevated heart rate. If metabolism's up, there's a higher demand for oxygen. The heart has to work faster and harder, so elevated heart rate. And a lot of times I can actually feel a thyroid nodule. Ultimately, though, we need blood work to make the diagnosis. So once we make that diagnosis, what can we do about it? Well, hyperthyroidism is treated in a number of different ways. Most typically, people will opt to treat with an oral medication that's given twice a day. It's commercially available as a tablet, but we can have it compounded into an oral liquid. And in some cases where people absolutely cannot medicate their cat, we can have it compounded into a transdermal preparation that you wipe on the inside of the ear. The problem is that that's not absorbed as predictably as something that's given orally, but it's at least an option for those who cannot medicate their cats. And the medication, just like with diabetes, the medication needs to be monitored and adjusted based on thyroid levels. So this isn't a set it and forget it type of treatment. It is a certain dose, and that's all you need to do. It's you start at a certain dose, 3 to 4 weeks later, you check the thyroid again. If it's not right, you adjust, you check the thyroid again 3 to 4 weeks later, repeat. And then periodically checking blood work, typically twice a year, to make sure that the thyroid and kidney functions are both good and that liver values and red and white blood cell counts are not being adversely affected by the medication. So there is monitoring that must be done to manage this appropriately and make sure that your pet is not having negative effects from the medication. There's also another means of treatment is radioactive iodine, which is how they treat people. So they basically inject a radioactive form of iodine. The thyroid uses iodine, and so it concentrates in the thyroid. The cool thing is that there's 2 glands for the thyroid, and the one with the tumor in it is the only one that's taking in the radioactive iodine. So it essentially gets destroyed by the radioactive iodine, and the other thyroid gland that is sitting dormant is unaffected. So that after this is all said and done, the normal thyroid gland can take over and they have normal thyroid function after that. So it's a great way to treat. They have about a 95% cure rate. Unfortunately, because it involves radioactive iodine, it has to be done at a referral center. These pets are radioactive when they come home, so you have to be very careful how you handle the urine and how long they sit on your lap and things like that for a period of time. So, and there's a much higher initial expense in this, but once they're treated, this is not something that needs monitoring typically for very long after the treatment. There's also surgery to remove the affected thyroid gland. I'm not a huge fan of surgery to do this because that means you immediately drop the thyroid hormone to below normal. I've seen the surgery done by a colleague once or twice, and the post-op period was kind of touch and go for the cats that I saw. So I'm not a huge fan of surgery. Some have good luck with it. I just haven't been impressed. In addition, Hill's Science Diet makes a prescription diet called YD, which is a iodine restricted diet. So it helps manage the thyroid issue as well. I do not see that as a treatment. I see that as an aid to help control it, and it's beneficial in cats that are tough to regulate via medication. So the other important take-home point is if you don't treat this problem, you're putting a massive demand on the heart, or the hyperthyroidism is putting a massive demand on the heart, and it will cause permanent heart damage and will lead to heart failure. So I sometimes see these cats come in congestive heart failure because they've been hyperthyroid for a while. So it's important to manage these guys. It's important to catch them early before permanent heart damage occurs. Also, because these guys have elevated blood pressure because of their thyroid problem, I've seen these cats come in acutely blind because they bleed into the back of their eye. So that needs to be managed and needs to be avoided. I've also seen these cats come in kidney failure because the high blood pressure from the thyroid has really done a number on their kidneys over time. The other interesting thing that happens with hyperthyroidism is sometimes these cats come in and on their initial blood work, their kidney function looks normal, but then we correct a thyroid problem and they now have kidney disease. And the reason for that is the thyroid problem is causing more blood to be pumped through the kidneys at a time, and so it makes the kidneys look like they're working well. Now when you back down that blood pressure and blood flow slows through the kidneys, the kidney disease can rear its ugly head. So this is why monitoring is very, very important with these diseases. All these systems are interrelated, and so you can't just take one value, treat that, and be done. You have to monitor these problems. All right, so let's talk about probably one of the most common things that we see in our senior pets at this point. I'll end hyperthyroidism there, so that you know what to look for and have a basic understanding of that disease, I hope. But one of the most common things that we see in our aging pets is osteoarthritis. Very, very common in pets over 7 years of age, statistically speaking. It may be secondary to things like hip or elbow dysplasia, but it can occur without those. All right. So typically the things that you're going to be watching for with osteoarthritis would be difficulty or slow getting up or down, difficulty with stairs, difficulty getting onto or off of furniture. Boy, this sounds a lot like my life. Reluctance to jump up, licking at one or more joints, and typically these symptoms get better as the pet moves. If you have arthritis, you understand that it hurts to get moving, but typically once you get moving, things start to feel a little bit better and you sort of quote unquote warm out of it. So those are our signs of some signs of osteoarthritis. So related to that, I wanted to do a little discussion on the signs of pain in animals, because this is a topic that is near and dear to my heart because it's something that I hear frequently from clients, and I think there's a huge misunderstanding about pain in domestic animals. People are under the impression, and I've heard them say to me, well, my pet's not in pain because they're not crying out, and they're still eating. If your pet is crying out, you've waited too long. If your pet is crying out, it's probably not a chronic problem. It's more likely an acute problem, and the pain is probably very severe. So think about this. If you are like me and you have arthritic knees, it hurts all the time, but I'm not crying out in pain, all right? Now, if somebody comes along and breaks my arm, yeah, I'm probably going to vocalize. I'm probably going to say something, yell, whatever the case may be. The same is true of our animals, only more so, because if you think about it, for our animals, even though they've been domesticated for thousands of years, they are still programmed to not show pain because it is not beneficial for them to show pain. If they show pain out in the wild, what happens? They get killed off, they get eaten. That is how nature works. And so crying out should not be used as a benchmark. Animals will eat, even if they're painful in many cases, because that's a survival instinct. So those are two benchmarks that I most commonly hear my clients using for signs of pain, which I use probably the least frequently of all the potential signs. Somebody just made a comment. Yep. So shaking. Yep. That can be definitely a sign of pain. It could be a sign of anxiety too. Yep, I agree. So when I say don't use these as indicators of pain, I don't want you to I don't want you to say that the animal's not in pain if they're not doing those things. I don't want you to exclude pain if you're not seeing those things. So here are some other things that you can watch for. Withdrawing from social interaction, reluctance or refusal to take part in normal activities, change in sleeping habits. Maybe the animal's up a lot during the night. It just can't seem to get comfortable. Or maybe it's sleeping more because it just doesn't want to move. Frequently changing positions, restlessness, panting even when at rest, and the ambient temperature is not such that they should be panting. Change in demeanor. Maybe a friendly dog becomes not so friendly, or maybe a cat that used to be friendly is no longer friendly, or maybe the animal seeking more attention than normal. That can actually go both ways. Hiding. Cats like to do that a lot. They'll just go off by themselves and you'll find them in odd places. Lack of grooming. Why? Because it hurts to groom. And so maybe their coat all of a sudden doesn't look good. Cats are starting to mat up. Why? Because they don't want to groom. Over grooming a particular body part. Well, if my ankle hurts and I'm a dog or a cat, I can't really do much about it except to try to lick it and make it feel better. Abnormal body posture, urinating or defecating in the house when they didn't used to. Why? Because they don't want to go outside. They just want to go wherever the heck they are. They're hurting. They're in pain. Not wanting to be picked up. Groaning when they get up or down. Now, this is the one time when I think you can hear vocalizing, is groaning when they get up or down. All right. You can see some change in appetite when the pain is really bad. I'm not going to deny that, but I wouldn't use that as a benchmark. All right. Also, guarding of a body part. Maybe you try to touch a back leg and all of a sudden the dog or the cat snaps at you. Well, that's an indication right there. So I hope this sort of gives everybody a better understanding of things that you need to be watching for pain. Animals do not express pain the way we do. Humans are wimps. I'm just going to say it. Humans are wimps. We whine about everything. We complain about everything. We're very vocal about our pain. We can easily express our pain to other human beings, whether they care or not. Animals are the opposite. They are trying not to show their pain on purpose. So you need to sort of learn how to read them, and I've given you a set of things to be watching for here. All right, so I'm going to get off my pain soapbox, if you will. That was just a little area I wanted to cover associated with osteoarthritis, because that's the main thing that animals are brought in for, is signs of pain. So what can we do to treat osteoarthritis? I can tell you that as a person who suffers from arthritic knees, weight loss, something that my doctor recommends to me, well, every time I go in, hasn't happened yet, if I'm being honest, but weight loss is key. And I could tell you from experience with my patients that many patients that come in that are arthritic, if you will commit to weight loss in that pet, you can go months to years without need for medication, even if they are arthritic. So maintaining lean body mass, this goes right back to our preventative care topic 2 weeks ago. Maintaining lean body mass is critically important. It's much easier to maintain lean body weight than trying to get a pet to lose weight. So weight loss is absolutely critical. I hear you, Becca. It's a thing. So Yeah, I get yelled at every time I go into the doctor's office. Um, Low impact activity is critical for these guys. Short walks on flat ground, swimming. If you can find a place with an underwater treadmill, that's awesome. And rehab is also very, very good, which may be at a board certified rehab center, or you can do things like passive range of motion, muscle massage, those types of things. Did I just see an angry face go by? I don't know. Anyway, um, so there are different things that you can do. You've got to keep these pets moving. If you think about the vicious cycle of osteoarthritis, it hurts, so I stop moving. So I'm not exercising as much, so I'm gaining weight. So the next time I try to move, it hurts more, so I stop moving. We've got to break that cycle. You've got to keep them moving. Swimming is super ideal for these guys if you have a place that you can do that. It's very low impact, keeps their joints moving, keeps a lot of stress off their joints. So this is a great way to keep them mobile. Some other things that we can do, chondroprotectives. What do I mean by that? Well, things like glucosamine and chondroitin and MSM. These products are to slow the progression of osteoarthritis. And I stress that because people often give it with the expectation that, oh, it's going to make my dog run around out in the field again. Not necessarily the case. So what I tell people is, even if you're not seeing a huge difference, continue giving it, because it is slowing the progression of the disease. Osteoarthritis is a progressive disease. Problem is that we often wait to start these products until there is severe osteoarthritis, and at that point, I find that they are less beneficial than if we had started early on. So I'm in the process of trying to change our protocol here on when we recommend starting these products. So you can be looking for that. Adequan injectable. I know that there is at least one person in this room right now who has used this product with some success in their own pets. This is an injectable product. It is given twice a week for 3 to 4 weeks. And it's labeled for injection in the muscle, but the good news is that many vets use it successfully given just under the skin. And we can actually, if you so desire, teach you how to give this at home under the skin. And so if any of you are interested in that, you can certainly talk to us about it. If the corgis are still here listening, if you want to learn how to do that at home, we will gladly do that for you. So there's an option for you. So, all right, the other thing that I recommend early on in osteoarthritis is omega-3 fatty acids. Any people here on omega-3 fatty acids? Some people are. Omega-3 fatty acids are beneficial in a number of ways. They reduce inflammation, and they're good for skin health, heart health, kidney health, and also joint health. They will reduce inflammation in the joints. And so often I'll recommend a combination of a chondroprotectant like glucosamine and chondroitin and MSM, and then an omega-3 fatty acid for these guys as well. So there's been some discussion about what the dose of fatty acids has to be, and some say it has to be really, really high. And so that could be a problem, especially for a larger animal. You don't want to give a bowl full of fatty acid capsules twice a day. So, all right, somebody said I start glucosamine when they're pups. Nothing wrong with that. Nothing wrong with that at all. Like I said, it's a protectant. So I think that the sooner you start, the better the benefit. Prescription diet. So here's Hills. I keep saying Hills Science Diet. Other companies have it too. I'm not like a Hills sales rep. I don't even sell pet food here. So I don't want anybody getting the idea that I'm trying to sell them pet food. So Hills Prescription Diet JD, which is for joints, has very, very, very high fatty acid content and antioxidant content, much higher in omega-3 than you can possibly give by adding supplements. Like you'd have to give like I don't know, 10, 15, 20 capsules twice a day to get the amount of fatty acids that are in this diet. And so very beneficial. Seen a great deal of success with dogs. There's also, I think Royal Canin makes one called Mobility, same type of situation there. So there's a number of different similar diets. I think Purina has one as well. So these can be helpful as well. Acupuncture. This can be helpful in many, many cases. And people would not believe that, you know, oh, my animal won't sit still to get needles stuck in them. Well, they will. In fact, some animals will fall asleep during the process. And I was not a believer until I worked with somebody who did this and I actually saw it with my own eyes. This can be very, very beneficial, and most animals will tolerate this very, very well, including cats, believe it or not. Cats will do well with this. So unfortunately, I am not trained in acupuncture, and it takes quite a long time to become certified to become an acupuncturist. So it's not on my radar at this point. There are some places around here that offer it, so we can sort of help guide and direct you, but acupuncture is certainly on the list of things that are helpful. Then there are other things. Yes, I know Dara loves her needles. Yes. So we have a client here in the room with us whose dog gets acupuncture, and she has seen benefit from that. So I can tell you it's very useful. Therapeutic massage, therapeutic ultrasound, TENS therapy. These are all other forms of therapy that typically are found at rehab centers that are helpful as well. One of the things that we offer here at Etc. is laser therapy. We use a class 4 laser. Lasers do a number of things. The primary thing is called photobiomodulation, which is a big fancy word. And it's not really hocus pocus or selling snake oil. I want you to think about this. How do you get vitamin D? You get vitamin D by going out in the sun, because the precursors to vitamin D are converted to vitamin D by sunlight. That is photobiomodulation right there, okay? So laser therapy actually stimulates the mitochondria in the cells, which are sort of like the powerhouse of the cells. So the cells that are very fatigued in an area that has been dealing with chronic injury can be revitalized in that way. And it also increases blood flow to that area. It also increases lymph flow away from that area, so it takes the bad things out of there. And all of these things actually stimulate reduction in inflammation and healing. It's completely non-invasive, it's painless. There's no medication side effects to be concerned about. It does require some back and forth, because typically there's 3 treatments in the first week, 2 the second week, 1 the third week, and then we sort of do it as the pet needs it at that point. Treatments last from anywhere from 5 to 25 minutes, depending on the size of the dog and the number of sites that we're actually treating. So it's another pain way to manage pain. So obviously at some point we need to add in pain medications. And hey, Pam, thanks for joining us. You notice I saved medications for last. I'm not a medication salesman, and I want to use all the tools at my disposal to try to help pain and to the extent that I can, avoid medications if we can. We're all concerned about the side effects of medications in our pets, myself included. So, so pain medication, most common thing that we use in pets with osteoarthritis or orthopedic disease is a non-steroidal anti-inflammatory drug. And common ones that we use are Carprofen, Daramax, Meloxicam. Some of you are familiar with some of these, and they reduce inflammation and thereby reduce pain. So it would sort of be the equivalent of you and I taking an Advil. Do not, I repeat, do not give Advil to your dog. I'm only going to say that. I can't stress that enough. Do not give Advil to your dog. All right? It's not the same. All right? So it reduces inflammation and pain. And this is probably the mainstay of treatment for osteoarthritis, just like in people. People take Celebrex, people take Advil, people take anti-inflammatories for their arthritic pain. There can be potential side effects in the liver and the kidney and the GI tract, so you need to be monitoring things. If you're being used chronically, it's a good idea to check blood work periodically just to make sure that we're not causing any liver or kidney problems. Thankfully, we don't see that very often, but it's a good idea just to be checking. Tramadol, this is an opioid pain medication given orally. It often needs to be given 2 to 4 times a day. Recent data brings in its efficacy into question in our canine patients. I don't know how I feel about this. I've got patients that respond very well to it, but there's some data out there that suggests that dogs metabolize it so quickly that it doesn't really do any good. And the more you give them, the faster they metabolize it. So it's a very, very strange scenario. But I often use it in combination with other medications, and I still find it to be helpful in some of my patients. Other medications that we will sometimes use, gabapentin. Gabapentin is good for nerve pain. It's also good for chronic pain. There's a huge dose range on what they consider an effective dose, and so we can often make adjustments to that, both in dose at each dose and the dosing frequency. So it's good for chronic pain and nerve pain. I often use it in combination with something else. Amantadine, which is an antiviral drug, ironically, is also a pain medication that I use as sort of a tertiary thing that can be added in with some of these others. So that's yet another pain medication we use. And then realize that there's an NSAID that is in particular approved for cats. It's called Onsior. The label says it's for 3 days use only after a surgical procedure. But I can tell you that some veterinarians are using it for chronic pain with very few side effects. And so that's outside the label recommendation, but it's something that's available. Also for cats that I don't have on this list is buprenorphine, which again is an opioid. Again, not something I like to use long-term if I can avoid it, because I do think that they develop a tolerance and you have to sort of at some point increase the dose to get the same effect. But sometimes combining Onsior with buprenorphine or having these cats on gabapentin and Onsior or some combination is the most beneficial. So the important thing with any chronic medication, whether it's pain medication, heart medication, thyroid medication, insulin for diabetes, these things should be monitored carefully. And pain management is critical to quality of life. Hubby says he takes that. I'm assuming you're referring to either gabapentin or tramadol. Those are both human drugs. And yes, I do have clients with chronic back problems on Ultram, which is tramadol. I do have clients that are on gabapentin as well. So I'm not surprised by that. Unfortunately, many of us suffer with chronic pain, and we have to get through. So treating arthritis effectively is a multimodal approach. There is no one thing that I can tell you to do that's going to necessarily fix the problem or make it better. It's multimodal, meaning we do a number of different things to try to bring our pets relief. And thankfully, there are more and more things becoming available. So the intent of this slide is to show you that there are a number of different ways that we have to treat. I want to thank Perrin 410 Animal Hospital out of Texas for letting me borrow their photo of the cat with acupuncture needles in it. If you can see, that cat is basically falling asleep with acupuncture needles sticking out of it. And there are electrical stimulus hooked up to those needles as well. So yes, your cat very likely will tolerate acupuncture, believe it or not. And then we have medications, we have laser therapy, we have diet, we have supplements, there's a lot of different ways that we can go about treating this. And then, of course, exercise, rehab, weight management all add into that. So, some other things that are new are fairly, I would say fairly new for the treatment of osteoarthritis is stem cell therapy and platelet-rich plasma. So stem cell therapy, I actually was certified through one of the stem cell therapy programs. I actually had 3 patients sign up, and unfortunately, I think one had kidney disease, another had cancer, and then there was an issue with the third one as well that meant that they were not good candidates. So your pet has to be in reasonably good health to go through with stem cell therapy, especially the stem cell therapy that I was part of. The patient has to be anesthetized. We collect fat, and then we FedEx it out to a central location for processing. They process the fat and harvest the stem cells out of it, and then they're FedExed back the following day, and then the pet has to be heavily sedated or anesthetized again, and the stem cells are injected into the affected joint or joints, as the case may be. There have been animals that have gotten 6 months or more of pain relief by doing this, and the stem cells can be banked for future treatment. So if you collect enough fat that you have stem cells left over, they'll bank them for you for a fee, of course, and you can use those for future treatments. Platelet-rich plasma has been used more recently, and the benefit of platelet-rich plasma is it doesn't typically involve anesthesia to collect the initial sample. You have to draw blood, a fairly large volume of blood, but you draw blood. And then in some programs, you can actually process this stuff in-house. It requires specialized equipment, a specialized centrifuge. So there's quite a bit of cost to the initial setup to this, but once the blood is processed and you get the platelets out of the blood and you get that platelet-rich plasma, then you can inject it into the joint. And it provides growth factors to stimulate repair of damaged tissue. So these are newer therapies that are becoming more and more available. Again, I was certified. I have to go through recertification on the stem cell therapy. The platelet-rich plasma, again, there's quite a cost to setting up to do this. Because you have to buy all the equipment to do it in-house. So probably not something that's on my immediate radar, but obviously something that I'll be looking to in the future. So. All right, so enough on osteoarthritis. I think we've covered that fairly well. I'm certain, if you have questions, again, just hang tight with me. Again, we went over an hour. I apologize. I'll try to run through the rest of this quickly. I want to talk briefly about cognitive dysfunction. We see this more so in dogs than we do in cats, but cognitive dysfunction in dogs is sort of like Alzheimer's in people. In fact, if you MRI the brain of a dog with cognitive dysfunction and if you MRI the brain of a person with Alzheimer's, they look almost identical. And if you do biopsies of those two brains, you'll get amyloid plaques in both of those brains. So the pathology is thought to be very similar. So what to watch for that would indicate that your dog has cognitive dysfunction? Dish signs. By that I mean disorientation, walking aimlessly, staring at walls, getting stuck in corners, losing balance, trying to go out the wrong side of the door and getting stuck between the door and the wall, those types of things. Interactions with people will change. The dog that once greeted you at the door, craved attention, is now ignoring you or hides in the closet. Sleeping patterns may change. Dogs who once snored through the night may pace relentlessly. It's sort of like sundowners in elderly people. So their sleep patterns will change. And then 2, house training. Dogs with cognitive dysfunction seem to forget that they were supposed to potty outdoors. And so I had a professor in vet school who had an open floor plan in his house. He had a little Yorkie that was like, I don't know, 16 or 17 years old. And the dog would just pace around the open floor plan all day long, and it would defecate. And then when it made the next loop on the floor plan, it would come out and look at the mess on the floor and be like, hey, who did that? So it can be frustrating for the owner. It can be, and I'm sure frustrating for the dog as well, having been through dementia and cognitive issues with my own mother. It was frustrating for her as well. So it's something that we see on a fairly regular basis. So there are some treatments for it, and we see some success. Two things that we can do for that are there's a medication called Anapril. The other name for it is selegiline. It has been used in Parkinson's patients. On the human side, I know that because my mom had Parkinson's, and it has been used with some success in dogs as well. We have to first rule out and treat other underlying issues that we often see with older dogs. But once we've ruled those out, we can consider this drug. And basically what we see is 33% of patients respond super, super well to it. 33% show enough improvement that we want to keep moving forward with it, and 33% basically show no improvement at all. So it's a mixed bag. That's basically what you can expect with this medication. And it's a long-term medication. It's not something they ever come off. And then again, there is a diet that is for that. And I know this sounds ridiculous, but this was actually developed. It was a collaborative effort between Hills and a neuroscientist who has studied dementia and Alzheimer's in people. And very, very extremely high in antioxidants, extremely high. And they've definitely shown some benefit with this diet. So I often will consider doing both of these things. All right, so we've covered kind of the things that I see the most frequently. Obviously, there are other issues. Older patients tend to get urinary tracts more readily, urinary tract infections more readily, so you need to watch for that. That will cause increased frequency of urination. However, unlike kidney disease, diabetes, hyperthyroidism, the volume is typically small volume, not large volume. Not always, but typically is small volume. And you may see some blood in the urine. And it's not necessarily associated with increased drinking, although it can be. Constipation in our older patients likely associated with dehydration. It can be due to other underlying problems like inflammatory bowel disease, but certainly kidney patients, diabetes patients, hyperthyroid patients that are drinking more and urinating more and losing water through their urinary tract may not have enough water to go into their GI tract, and so they become constipated. So there's typically a secondary issue. Diarrhea is typically associated with something like inflammatory bowel disease or intestinal cancer. We sometimes see that with hyperthyroidism. Skin problems, it can be related to many of the underlying illnesses we've already discussed. And obviously cancer, that's another big one that we see a lot of. And there's too many types for me to cover in this particular venture. But cancer of the spleen, cancer of the bone, skin tumors, soft tissue sarcomas, etc. We see a lot of that in our older patients as well. So lumps and bumps, you want to have them checked out. So the big thrust for this is, with our elderly patients, is that early detection of disease maximizes the chance of successful treatment for management. Know what to look for and don't hesitate to take action. Be proactive. Consider annual wellness blood work and urinalysis for your pet. Ideally, we would start at 6 or 7 years of age. And the reason for that is, at that age, unless it's a very large dog, it's likely the blood work and the urinalysis are going to be normal. So why would we do that if it's going to be normal? Well, we can establish a baseline, which is critical, because What we'd like to see is we'd like to catch our blood values when they're going up. They're trending upwards, but they are not outside the normal limit. That would be a great time to catch disease and intervene rather than waiting until things are truly abnormal. So trends make blood work easier to establish and treatment to be established, and it also aids in early detection. So we'll briefly cover, I can't believe there's still 11 of you here, even though I went this far over. You guys are awesome. You guys are truly the best. So things that you could do at home to improve quality of life. Just realize that these guys are often having a much harder time getting around. So provide easy access to outside, provide easy access to water bowls, and please provide easy access to the litter box, okay? For our feline owners here, I often hear, oh, my cat's not using litter box anymore. And when I question them, I say, where does your cat spend their time? Oh, on the main floor of the house. Where's the litter box? In the basement or on the second floor. That's not fair, okay? The litter box needs to be as close to that geriatric pet as possible if you expect them to keep using it and using it accurately. So please be aware of that. And don't force your older animal to do stairs if it doesn't have to. So find another way out of the house if you can. Put in a ramp if you can. The least number of steps is beneficial. Provide orthopedic bedding. Egg crate foam works really well. I know a lot of you said, well, I bought one of those and my pet won't use it. Yeah, I've been there, done that. But hey, you can at least try. There are warmed beds out there, and cats in particular seem to really appreciate those. Arthritic cats in particular really like those, especially in the wintertime. So those can be very beneficial as well. Thanks, Sharon. I guess some of you guys are taking off. I don't blame you. Bye, Becca. Free access to water at all times. Water requirement may go up. Do not restrict water if your pet is drinking more. If your pet is drinking more water than normal, find out why. Don't just pull the water bowl away. You actually may be doing more damage that way. So be careful about that. Grooming. Frequent brushing with a gentle brush, no wire bristles, can be very helpful. Older pets tend to not groom as well. This can lead to matting and skin problems. Steps or ramps. Your pet may struggle to get up onto the bed, the couch, the window where they like to spend their time. Struggling predisposes to injury. Make it easier for them. Monitor for changes in eating, drinking, urinating habits, change in sleep-wake patterns, changes in activity level, changes in hearing and vision. Don't chalk up changes to normal aging change. Many of these issues that we discussed can be treated and managed. Other things that you can do, low impact exercise. You must keep your pet moving. Lack of movement leads to weight gain, which puts more stress on the joints, making movement more painful, and is a vicious cycle. Low impact exercise, short frequent walks, swimming, passive range of motion. For cats, hiding treats around the house at ground level, so they have to search for them. We discussed this in our last talk on environmental enrichment. This can keep them active. Fatty acid supplements, glucosamine, quality nutrition. If your pet can't see well, don't rearrange the furniture. Use runners on slippery floors. Your older pets may slip and fall more easily. And be careful bringing a younger pet into the home if you have a geriatric pet. A young animal that is very exuberant may be stressful to older pets. All right, for those of you who are left, would you like to go to question and answer, or do you want to discuss end-of-life decisions? Which would you prefer? Question and answer or end-of-life decisions? You can just write a comment in there if you would. All right, I got one vote for end of life. Are we all on board with that? There's still 10 of you in the room, according to my counter. All right, 2 votes for end of life. Hi, Lisa. Okay, very good. All right, so we're going to push forward with end of life. You guys are awesome. I tell you what, you seriously are awesome. You're here at 9 o'clock at night on a Monday night with me. I'm very humbled by that. Um, so end of life decisions. So how do you know when it's time to make the ultimate decision for your pet? And quality of life is key. This is what it ultimately boils down to. Is your pet just existing? Just because they're breathing and their heart is beating doesn't mean that they have quality of life. And so the quality of life is the thing that I stress the most. So if your pet is having more bad days than good, um, then that might be time. Is your pet happy to be here, or is he or she just existing? Are they enjoying the things of life that they normally enjoyed at one time? Are they just waking up, eating, urinating, defecating, going back to sleep again? That's just sort of existing. Um, so please, I beg of you, do not use still eating or not crying out as sole indicators to not put your pet down. I'm not saying that you have to put your pet down if they're not doing those things. I'm just saying that those are, again, when I tell people, your pet has reached a point where it's suffering, they say, well, it's still eating and it's not crying out in pain. Those are not good indicators. Okay. Obviously, if they're crying out in pain, yes, that's a good indicator. If they're not eating, that may be an indicator, but those are not on the top of the list. All right. An animal can feel absolutely miserable and still eat and not cry out. It does not mean that they're not suffering. Think of it this way. If I break my arm, I'm painful, I'm acutely painful. If I have the flu or some serious illness, cancer or something like that, I may not be quote unquote in pain, but I'm still miserable, right? So that's the kind of the analogy that I try to throw out there to people, is that crying out is not always and not eating are not key indicators. All right. There's a tool that I like to use with some of my clients because I've been there many times, as many of you have, and the decision never seems to get easier. Even for me, as a trained veterinarian, when it comes to my own pets, the emotional side of me takes over, and the logical side goes out the window, and the medical training goes out the window, and I struggle just like you guys do. All right. So there's a tool that I found by Ohio State, and it's a little survey that you can take. It's called How Do I Know When It's Time? And it gives you a list of questions, and you can sort of rate your pet's quality of life on a scale. And then when you get down to the bottom, you can sort of, it helps you decide, am I more towards the poor end of things, or am I more towards the good end of things? And it's not, I don't want to have you guys think that I'm trying to boil this down to a math equation, because it's not what it's about. But I think this tool is useful to help you objectively evaluate and put the emotional side of things aside, and take an objective view and say, yeah, you know what? Regardless of what my heart's telling me, objectively, when I look at things and I go through this tool, things are not good. And this tool has helped a number of my clients come to the ultimate decision. And so it's something that is available. It's out there. It's online. You can actually just Google it and print it out. But I hand this out to a lot of my clients. So I know those decisions can be tough, but ultimately, quality of life is the key. So some things to think about when we're talking about euthanasia. Um, just watching your comments here, guys. Yeah, I know, Sharon. And Becca, you're absolutely right. Yeah, and you know what, Carol, for those of you who know Carol here, I agree with what she says. I would rather make the decision a day too early than a minute too late. And she says that often, and I have to agree with that. I think we owe it to our pets. So when it comes to euthanasia, there are some things that I think it's very helpful for you guys to think about ahead of time. And so you're not trying to make difficult decisions at a time when emotions are at their absolute peak. And that is, when I put my pet down, do I want to be present? Who do I want to be there with me? Do I have an emotional support network? And it may be a husband, a wife, a boyfriend, a girlfriend, a neighbor, another family member, whoever that may be. Who do you want there to be there with you? How will you handle telling your kids? Here's the thing about pet loss. Pet loss is often for a child the first time that they experience death. And it's often hard to explain to a young child the whole death scenario. And it can be very, very difficult and challenging. As a parent of 4 kids, I could tell you I've been through it enough times now. But I empathize with parents on how they handle that with their kids. Do you want your kids to be there? That's another question. Will it be done in our office or in your home? Some of you may or may not know that we do in-home euthanasia. It's something that we offer. You know, in-home euthanasia, I think, is important for a lot of people because they don't want their pet's quote-unquote last memory to be the vet's office, or they don't want it to be done in a quote-unquote sterile environment, or those types of things, which I totally get. I completely and totally get. Otherwise, I wouldn't offer in-home euthanasia. The difficulty of in-home euthanasia, from my perspective as a solo practitioner, it's very hard for me sometimes to get that scheduled in. And so we try to be as flexible as possible to make that happen. So yeah, Becca, it is something that we offer. We do offer it in-home euthanasia. So I don't advertise it heavily, but yeah, it is available. So the other question that you have to ask is, what do you want done afterwards? Do you want burial at home or at a pet cemetery? And then cremation service, do you want with ashes returned or without ashes returned? These are all very personal decisions, and there's no right or wrong answer. Again, who is your support network? Do you have someone you can talk to? I am betting almost everybody in this room who has put a pet down has met people that have totally just wrecked your world by saying things like, well, it's just a dog, just get another one. Or things like, it's just a cat, get another one. Those people are not your support network. They will never understand. So decide ahead of time who your support network is and who you can talk to. It will never be easy, but the more you have planned ahead of time, the easier it will be. If you have some of these questions answered before you walk in the door or before I walk in your door, things can go a whole lot smoother than if you're trying to think through all this stuff at the moment. So I have had clients who have literally come to us and said, when my pet has to go, I want this, 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 and this done. And we will put that in their file for future reference. So things to think about ahead of time. All right, guys, that pretty much wraps the presentation at this point. I am open for questions at this point. It is currently 9 o'clock. You guys are awesome. You are the best of the best hanging out in this room with me right now. If you guys have questions, type away, and I will do my best to answer those questions. Thank you, Cindy. I appreciate that. Yeah, Lisa, you know, why don't you shoot me an email about that? I want to see if is it just VetMed or are there other heart drugs that we're on right now. So I want to talk to you about that. So send me an email on that. All right, Pam. Thanks. Sorry, guys, if I keep turning my head. I'm watching responses on one screen and talking to you guys on the other screen. Um, so Ken, I don't, as far as it may benefit Shayna. Who's doing acupuncture? As far as I know, they're doing acupuncture at Mountain Shadow and at Pine Grove, but I don't know that for certain. But those would be two possibilities for you. Um, oh, you're welcome, Sharon. You're welcome. Thanks, Becca. You have a great night too. I appreciate your coming in. I know what you mean, Aurora. I get it. Yeah, you have a good night too. Thank you, Lisa. I appreciate that. Oh, you're welcome, Ken, and I'm assuming Lisa as well. Thank you, Carol. I appreciate everybody's encouragement. I hope to do more of these in the future on various topics. If you guys have topic ideas, please don't hesitate to message me through Facebook or email me or text me or whatever. Send me some ideas and I'll try to make things happen here. I know, Linda. Never easy watching our fur kids get old, ever. Thanks, Sharon. Not very likely, but thank you. I will try and get some rest. You guys stay safe in the weather tomorrow. It looks like it's going to be pretty ugly out there, so I want you guys to be careful out there. All right, guys, if there's no questions at this point, I think I'm going to sign off. Dinner's waiting for me, so I'll go. And again, if you have any questions about tonight's topic or presentation, feel free to send me an email at Dr. Steve at vetcetera.com, or give us a call, send a text, send us a Facebook message, whatever you need to do. If you're sitting at home thinking about the presentation and some of the things we covered, please don't hesitate to reach out to us to get some things clarified.